Hi, and welcome to In Our Community. I'm your host, Erin Nelson. October is Women's Health Month, and here at Corona Regional Medical Center, they want you to be aware about important health issues concerning women. And in upcoming shows, we'll be talking about issues as prenatal health and delivery services and the latest advancement in gynecology services. But today we're going to be talking about breast cancer and hormone replacement therapy. And joining me on these important topics are Dr. Evangeline Reyes and Dr. RuPaul Shah. Welcome, doctors. And Dr. Reyes specializes in hematology and oncology here at Corona Regional Medical Center, and Dr. Shah is a family practitioner who is also involved with the Women's Service Program here at Corona Regional Medical Center. Thank you, doctors, for joining me today and talking about these important health issues for women.
Thank you, Erin.
Thank you, Erin.
Let's begin by talking about breast cancer, and Dr. Reyes, you're going to talk to us about that. This is such an important issue today because it affects so many women, whether it's personally or family. But before we get started, I would like our viewers to get to know a little bit about you. And if I can ask you, where did you attend medical school?
I went to University of the East in the Philippines, and then I did all my training in the East Coast, in Massachusetts, my residency, and in Medical College of Virginia for my fellowship.
Okay, and you've been practicing here in Corona for how long?
Since 2001, I believe.
Okay.
Yes.
And why did you choose hematology and oncology as your
Actually, it's a really personal issue. When I was 8 years old, my grandfather died of leukemia, and then when I went through medical school, quite a few of my mom's friends had helped me through, but when I graduated, they all had died from cancer.
Right.
So it became sort of a personal issue for me to go into oncology.
Right. And you're also a recognized advocate for breast cancer prevention and early detection in the community, and give lots of presentations about throughout the Inland Empire about the detection and prevention. And so is that where that derives from, that feeling of having it in your family?
Sort of. It's just that, when you've gone through, you've gotten the training for oncology, and you know the statistics, and you know that there's a chance to be able to make a difference in terms of saving lives, it becomes more of an important issue. If you look at the statistics, the Inland Empire has diagnosed about 2,000 women with breast cancer on a yearly basis, and the majority of the women who become diagnosed, I would say, is an early stage 1, 0 to 3, which means that there's still a good chance of cure, and the earlier you detect it, the greater your chance of cure. And with mammograms, we're able to make a difference. So if I can try to somehow make an impact and teach women about what to look for and how important it is to do their physical exams and get the right screening, we may be able to make much more of a difference and increase women's lives. So that's an important aspect, and I guess that's the reason why I'm interested in education and reaching out to the community.
Right. Those are very interesting statistics. And with so many women at risk, I believe our viewers really need to listen in and kind of get out what we're talking about and really apply it to their own lives. Can you tell me more about some of the risks of women developing breast cancer?
Well, if you look at the statistics in who develops breast cancer, I would say about 98% are women. So the biggest difference between women and men is estrogen. So if you look at risk factors, you look at how much estrogen exposure there is, but the biggest risk factor, other than being a woman, is increase in age. So breast cancer is truly a postmenopausal disease, and about 75% of women who are diagnosed with breast cancer are over 50 years of age, and so those are your biggest risk factors. A lot of people think it's family. However, that only accounts for about 10%, and it's only in certain situations wherein the family members are extremely young, I would say in their 30s or 40s, that you would also start to consider family as a risk factor. And again, there's some environmental issues as well. However, those don't play as much of risk factors. We can always speculate about caffeine and physical therapy, physical activity, but we're not completely sure how that all correlates to the risk of breast cancer.
Right. And you kind of touched on this. I was reading in an article that also playing a role in heightened risk for breast cancer is breast density, and that women ages 45 and older who have at least 75% dense tissue on a mammogram are at an elevated risk. And a slight increase in the risk of breast cancer is associated with having their first birth after the age of 30 or older. Can you comment on that and how that relates to it?
There was a recent New England Journal looking at benign breast diseases and to see if it correlates with the risk of breast cancer. And women with benign disease, such as a fibrocystic disease or fibroadenoma, have on an average 1.86 risk of developing breast cancer over the general population. Another one is something called atypical hyperplasia, wherein there's a fourfold increase in risk. And again, if you look at the age of when women should be having children and the risk of breast cancer, it all again relates to the amount of estrogen that a woman is exposed. So a woman who has a delay in their menses, let's say more than 12 years of age, you decrease the risk of breast cancer by 10% for every 2-year delay. Whereas in a woman who has a child after the age of 30, their risk increases for breast cancer. And again, you have to look at where when a woman starts to have her menstrual cycle up to the time where she goes into menopause and how much estrogen that woman is exposed to. And that's an endogenous exposure as opposed to exogenous exposure, such as your hormone replacement therapies.
Wow, that's fascinating. Well, I have to take a quick commercial break, but when we come back, we'll talk about some of the signs and symptoms that women need to be aware of. We'll be right back after this.
Your kids won't tell you what you want to know about ecstasy, but we will. Go to drugfreeamerica.org. Your kids might think they know everything about crystal meth. You really can. Go to drugfreeamerica.org.
Welcome back to In Our Community. I'm your host, Erin Nelson. Today I have joining with me Dr. Evangeline Reyes, who is talking with us about breast cancer. But we also have Dr. RuPaul Shah, who is a family practitioner, and she's going to interject a little bit about breast cancer. And we're going to pick up talking about some of the symptoms. And what are some of the symptoms of breast cancer that women need to be aware of?
As for me, as a practicing oncologist, the most important symptom that a woman has to be aware of is a mass. Any mass that a woman feels is abnormal. Other symptoms that women will complain about are breast pain. However, that may not always indicate that a person has breast cancer. Other changes are bloody discharge or nipple discharges are completely abnormal, or skin changes. But as an oncologist, I generally don't see women when they present this way, and I'm sure Dr. Shah is a family practitioner usually sees other symptoms, and I was wondering if Dr. Shah could tell us a little bit more what she sees in her practice.
Normally what I see is that when patient comes in, I train them how to do the self breast exam every month, and during examination most of the time they themselves find a small lump which is not there before, which is increasing in size or different than before exam. So we do the test on them, which is a non-invasive test, mammogram. Some women do get ultrasound, and depending on the lesion, depending on the pathology of it, we recommend them to follow up with the specialist.
All right. And as we're talking about mammograms, at what age should women start regular checkups?
The guidelines indicate that women should start at the age of 40. Annual mammogram thereafter. However, patients who are at extremely high risk, strong family history, the rule has always been to start mammograms 5 or 10 years younger than the youngest member who's developed breast cancer. And the other recommendation is they've not really looked into continuing mammograms after the age of 70. However, I sort of disagree with this because breast cancer does occur after the age of 70, and that's your highest rate. And I think as long as a woman is extremely healthy, she should continue getting annual mammograms.
All right. And for both of you, what is the urgency of a woman who notices a lump during a self-breast exam, and then a doctor who actually notices cancer during a mammogram? What is the severity of the cancer, the progress, by the time she feels the lump herself?
As an oncologist, my answer is probably going to be a little bit more different, and that stems from the fact that with mammograms, they are able to detect masses 1 to 2 millimeters small, and by the time breast cancer develops to that size, it's about 6 centimeters. Now, when a woman feels a mass, it's about 1 centimeter, and that's an additional 3.4 years that if a woman had undergone a mammogram would have a head start versus detecting it on her own. But I think it's always important not to ignore breast masses, but I'm sure Rupa probably has a different take on this.
Usually I agree with you in the mammogram detecting 1 to 2 millimeter size mass. My policy and my way of practicing medicine is that there is no age. If you feel a lump in the breast, don't ignore it till we rule out that there is no pathology suggesting cancer.
Mm-hmm.
So any woman at any age, if she feels a mass in her breast exam, she should see a doctor right away. Instead of ignoring it, it's good to get the test done and make sure that it is not turning into a cancer.
Right. And after the doctor has confirmed that a woman has breast cancer, what is the next step that she should take?
She should call me. I think it's important for a woman to be seen by an oncologist to go over all her options. And nowadays we're looking at treatment of breast cancer as a multidisciplinary unit, meaning not just the surgeons, the radiologists, the pathologists, and the oncologists, but even the general practitioner should be involved.
And then, so that is, so some of her options would include after she's been diagnosed?
I think it depends upon what stage we're looking at. You know, the treatment options are different from stage 0 to stage 4. Stage 0 to 3, we're looking at, our goal at that time would be for a cure, whereas stage 4, we're looking at trying to improve the quality of life. So options are very individualized, and I think it depends upon, number one, the patient's feelings, as well as what stage we're dealing with in terms of the breast cancer.
Okay. And Dr. Reyes, what are the latest treatment options for women?
Oh, I think it's going to continue to get better.
Yeah.
I think we're looking at hormonal agents that are better than what we've seen in the past, such as tamoxifen. We're starting to use these not just in the metastatic setting, but the adjuvant and neoadjuvant. And what's really exciting, because most people, when they think of treatment for cancer, they think about chemotherapy, but what's most exciting nowadays is the trials that we're seeing using something what we call targeted therapies, such as new drugs as Avastin, or even the use of Herceptin, which we were able to get approved after it was under trials, and it was even considered a lottery drug. I mean, I can go on and on about what new things are available, and how I practiced treating breast cancer is, I would say, 180-degree turn from what I was when I was a fellow under training.
Mm-hmm. So it's come a long ways, and it's sure to grow.
It's come some ways, but I think we have a lot more room to go, and like I said, I mean, we can make a difference as long as we see it early enough.
Right.
I agree with Dr. Reyes, because we are the one, primary care physician are the one who is diagnosing the breast cancer and sending patient to oncologist. But I would like to say that when woman hears a word about breast cancer, now and 10 years ago, it's a big difference. Mm-hmm. First thing I tell them that this is a disease which is treatable in early stage. This is a disease which has a multiple mode of therapies available for them. It's not always like 10 years ago that you end up in losing your breast and get the mastectomy. Mm-hmm. You can save your breast and have the therapy which can give you quality of life and also decrease the morbidity also. So I agree with Dr. Reyes that the way this medicine is progressing is very beneficial to the community and the medical society.
All right. And once we've been treated for breast cancer, or once somebody's been treated, is there a possibility for it to come back?
There's always that risk, but we can't live our life waiting for that other shoe to drop.
All right. Well, we're going to take another break, and when we come back, we'll pick up right where we left off. We'll be right back.
You might take meth because of how it feels. But this is how it feels to your heart. The only difference is you can't rebuild a heart.
Welcome back to In Our Community. Now we have a few questions from some of our viewers about breast cancer, so I'll go ahead and ask a few of those. This first question comes from a lady who is 44 here in Corona, and she said that I was diagnosed with breast cancer and was referred for care out of the area because my primary care physician felt there was no place in the Corona area to seek treatment. What resources are there locally for the treatment of breast cancer? And I know you guys have the answer for this one. So,
there's been quite a lot of advances, and I myself have worked very, very closely with Corona Medical Center in bringing the technology up to date and offering them trials. I really believe that you don't have to go to a tertiary care center outside of the area to get good help. There are quite a few good oncologists in this area, and we're constantly reviewing all the slides with the pathologist. It is just not going to see a doctor and getting one opinion. It's a conglomeration of different opinions, and with the technology at Corona, we're doing things like PET scans that you normally wouldn't have had to go to. We would have had to go to Orange County to get, and the Imaging Breast Center is a great resource. It's quite quick. Quite a lot of women are impressed by the center, and we also have the infusion center here, where there's a lot of resources with regards to all types of cancer. So there's quite a lot of things here, and we're also working, I myself am working very closely with other female physicians, because I really think it's important that women keep in touch with women, and we sort of call ourselves the women's physician of Corona and Norco, and I think it's very important that we educate other women, and there's nothing like another woman telling another woman what's going on.
Mm-hmm. All right. And before we turn our attention to hormone replacement therapy, what other main points and thoughts would you like to get across to our viewers?
Just be aware, and I can't stress that enough. When you feel a mass, go see your physician, and then after that, everything else can be taken care of.
Okay, and if our viewers have any questions, or where can you be contacted, or what information can you give our viewers?
I'm with Compassionate Cancer Care, and our phone number is area code 951-371-2411, and I work with 4 other oncologists, and we'd be more than happy to answer any kind of questions. We also work closely with the American Cancer Society and also with the Corona Medical Center. So call us.
All right. Well, thank you so much, Dr. Reyes,
Thank
for talking
you.
about breast cancer. And we're going to kind of switch gears a little bit, and now we're going to talk to Dr. Shah about hormone replacement therapy. And before we get started, I would like to have our viewers get to know a little bit about you and ask where you attended medical school.
I attended medical school in India, came here, did my residency at San Bernardino Hospital, which is affiliated with UCI. I'm board certified family practitioner, and I'm in Corona since '94, so quite a long time I'm in Corona, and I enjoy working with the hospital and all the female physician of Corona Norco, our group. I'm a solo practitioner since last 5 years.
Okay. And why did you choose to go into family practice?
My main passion about family practice is I would like to take care of the whole family as a unit, because I don't believe that the medicine is only for a part of body. It's the whole person I like to treat, and that's the only branch which can fulfill my passion to treat a person as a whole, and the person is a part of family. So I would like to be a family physician and I have 4 generations come to my office, and it's amazing to understand their dynamics, family dynamics, and the
Right.
medication. So it's just one of those things I would love to do it.
That is very exciting. And we're going to talk about hormone replacement therapy. And we see a lot of this on the news today and about people talking about hormone replacement therapy. Can you break it down for us in its simplest terms so we can understand what is hormone replacement therapy?
The hormone replacement therapy means basically it's self-explanatory word. When women go through certain transition phase of life, the hormone level gets up and down, and eventually you try to give the quality of life, try to replace those hormones. There are two different ways you can do it. It's a traditional hormone replacement therapy, or the new one they're doing now more is bioidentical hormone therapy. Bioidentical hormone therapy is basically the hormone is chemically similar to what naturally our body produces. So it's biologically identical, chemically identical to what our body produces, and it's made synthetically, but it's made in compounding pharmacy, and it's basically it's individualized therapy. So it's not that one prescription can fit all. It's everybody's requirement is different, and that's what basically I'm interested in doing it. That
Right.
it's not one size fit all. Everybody have their own requirements in estrogen and progesterone. Those are the two main hormones women need after menopause or during perimenopause time.
Okay. Can you tell me about the age that women are confronted by HRT, or what some of their symptoms are?
On an average, the age usually starts around 40. Normally, they start going through the changes around 40. And then the symptoms are, some people do feel lapse of memories. They have a problem in cognition. They feel they're getting more forgetful. They get hot flashes. They get decreased energy level. They go through irregular menstrual cycles. So there are certain symptoms related to particular hormone, and that's why they ask for doctor's help.
What are the most common hormones used? And you kind of talked about this a little bit, but what are the most common that we're seeing being used?
The most common hormone in female at menopause is estrogen, progesterone, and sometimes testosterone.
Okay. And we heard so many important statistics from Dr. Reyes on the number of women affected by cancer. It is my understanding that HRT plays an important role in the treatment for all different kinds of cancer affecting women. Can you comment on this?
Actually, the HRT is not a cause of cancer. It works like a fertilizer. If somebody has the seeds of cancer, then HRT helps that seeds to grow. In simple English, it basically enhance the cancer, the growth. But the new technology, as Dr. Reyes said, they are coming out with certain medication which can help the breast cancer, which is also a part of the hormone receptors.
Right.
What I'm talking about HRT is that HRT is a hormone replacement therapy. If a woman is regular in follow-up, if woman is regular is taking her mammogram, taking her blood test, having a regular follow-up with a physician, chances of developing breast cancer because of HRT are low.
Really?
Because even if she develops, you can immediately diagnose it and take care of it.
Okay. And when we come back, we're going to talk about some of the symptoms that women need to be aware of and what they need to be looking for as far as hormone replacement therapy. We'll be right back.
It's a horrible feeling to know that somebody out there is trying to hurt your kid.
We worry when the kids go out and go to school.
I mean, it is so easy for them to just get into drugs and gangs and everything.
And that's why I say it's very important to keep your kids doing different activities.
We decided to start a dance group, Ballet Folklorico San Jose, to keep all these kids occupied in something so they stay away from drugs.
We are not perfect parents. We just really worry about our kids.
Welcome back to In Our Community. We don't have a whole lot of time left, but we're going to wrap up talking about hormone replacement therapy. And the next question that we have is, after the doctor has confirmed that a woman is in need of HRT, what are the steps and what is involved with treatment?
Basically, when a woman comes and have her symptoms, say to the doctor that these are my complaints, I doctor does some blood tests to confirm that she's going through or going towards menopause, and also make sure that do the complete physical exam, including mammogram, to make sure there is nothing pathologically going on with her. After that, we discuss the mode of therapy, if patient is interested in taking oral therapy versus cream or patches. So there are very different varieties of mode of treatment available. You can have tablets, you can have a patch, you can have the patches are once a week, you can have vaginal cream. So all those mode of therapies, according to requirement of the person, we decide.
Okay, and that kind of rolls into my next question. In terms of effectiveness, the route of administration is important. Which one is the most effective?
Actually, depending on what their symptoms are. For example, if they have atrophic vaginitis, which is low estrogen effect on vaginal mucosa, and having the problem with that, the cream is much better route to use. If somebody is not regularly taking medication or have some problem with liver, then the patches are much better route to use. So depending on their medical history, we choose and we discuss with patient before we prescribe it. But I also want to add that before prescribing, we also make sure that person does not have any strong family history of breast cancer or any hormone-related cancer in the family, or does not have any past history of any blood clots. These are the main thing. In certain conditions, we don't recommend hormone therapy.
Dr. Shah, if a woman starts on HRT, is she on treatment for the rest of her life?
Usually, the HRT, I recommend it for 5 to 7 years, and depending on after that, what is her comfort level with it, because it does have accumulated risk on breast cancer, means number of years they take the HRT, it little bit increases the risk, but I definitely help them to go through the transition time of the menopause and perimenopause time. So up to 5 years, it's very safe to take the hormone replacement therapy if they don't have any contraindication.
Okay. We have some questions from our viewers, so I'll go ahead and ask you some of those now. This first question we have is, are there things I can do to prevent having to go on hormone replacement therapy?
Actually, this is a biological process. Every woman goes through the hormone changes during menopause and perimenopause time, so there is nothing anybody can prevent to go through that biological changes. You can delay it by doing regular exercise and having healthy lifestyle, but it's not something preventable.
Okay. What are the benefits of hormone replacement therapy?
The best benefit I can see is the quality of life. Going through the transition phase, I have seen my mother going through it, and I understand that the quality of life is big important thing for me and for every woman. For example, they get forgetful, they're having hot flashes, they have decreased libido. All those symptoms are a sign of menopause and perimenopause. So quality of life is very important, and I believe that there is medical help available and they should take advantage of it.
All right. And if our viewers have any questions for you, where can you be reached and be contacted?
Absolutely, they can visit me, they can call me anytime. I practice in Corona, and my office is 770 Magnolia, Corona. My phone number is 951-738-0303. Anytime they can call and come and see me.
All right, well, thank you very much, Dr.
Thank you.
Shah. And thank you so much for talking about breast cancer as well, and it means a lot to have both of you here to talk about these important issues. So thanks for watching, and we'll see you next time.
Okay.